Hey, hi everyone. Can you all hear me well?
Yes.
Okay.
Yes.
Okay. Thank you so much for joining us today. Um, I will just give the floor for a second to Anna Garson, who's gonna um, get us kick-started with this process today.
Great. Thank you, Ricardo. Yes, welcome everyone. My name's Anna. I am a portfolio manager in the super pollutants team at the Clean Air Fund. And I just wanted to give a sort of warm welcome to everyone. For those of you who aren't familiar with the Clean Air Fund, we're a global philanthropic organization working at the intersection of climate change and health. And last year we launched our new portfolio on super pollutants, which mostly is working on black carbon, but we're also working on tropospheric ozone. So the inputs that you can provide to this in this meeting today are fundamental to our work on tropospheric ozone, led by Clean Air Institute, Hill, and Clean Air Task Force. So we really, really appreciate your time and your energy today. And as always, if there are any questions, please don't hesitate to get in touch. But welcome and thank you so much. Back to Ricardo.
Okay, thank you. So my task here today is just to keep us on track regarding the time and basically just walk you through the methodology of what we're gonna do today. So let me see. So the objective of this blueprint we're working on is really to establish a route from, like, in the near term, from 2025 to 2028, outlining specific activities that will allow us to achieve international consensus and cooperation on including tropospheric ozone in the global agenda and advancing its control. We have two main goals for today's session. The first one is just to produce a short list of prioritized actions. And we will be doing that by discussing which ones are the high-level strategies needed for each work stream. In this case, the scientific background of tropospheric ozone control during this short timeline of 2025 to 2028. So we have to prioritize those actions. And we need to go one step further, and we have to come up with more granular and tangible steps that can make those prioritized actions actually implementable in this short time frame. So this is really the task that we have at hand today. There will be time for open discussions. I'm going to just show you the proposed agenda for today. So this is just the introductory part. We will have a brief round of introductions for the participants helping us today. Then we will have the focus activity for 25 minutes, trying to came up with this short list of prioritized actions. We're going to have to actually order them in order of priority. And then we will have an open discussion to really define these prioritized actions. And we will be defining the tangible steps, the key actors, the financing opportunities, and barriers that we might find in actually implementing these actions. And with that, we're going to get started with our introduction. So please go ahead and introduce yourselves, the people that's invited to participate in the panel. So I don't know who wants to be the first one. In lack of volunteers, I was gonna volunteer Chris. I think you were about to do it, so go ahead, Chris.
Hi, Ricardo. Yeah, hi, everybody. My name is Chris Malley. I work for the Stockholm Environment Institute based at the University of York in the UK, where I live. Nice to talk with you all.
Thank you. Yeah, please go ahead.
So hello, here is Kedin Lu from Peking University. So here I'm a full professor in the College of Environmental and Science, and I'm the director for the National Ozone Lab here. So I study the tropospheric ozone formation mechanism and also control strategies. Yeah, thank you.
Perfect. Yeah, go ahead, Savannah.
Hi, good morning. I'm in LA now, so very early morning. I don't know where you are. I'm Zorana Jovanovic Andersen, professor in environmental epidemiology at the University of Copenhagen, Denmark. Also have worked a lot with European Respiratory Society on advocacy on clean air in the last number of years and information to patient groups and medical groups on air pollution health effects. That's my main area of research and work. Thank you.
Perfect. Anna or Monica, are we missing someone from the panel? Monica, do you know it's Dr. Raga going to join us today? Sorry, it seems that we are having some technical issues. Or Anna, do you know if we're waiting for someone else to join us today?
Hi, sorry, yes, I'm having issues with my sound. No, I think this is everyone.
Perfect. So yeah, so let's move to the next next activity. Is just basically the context. This is probably something you all know very well, like why should we take action on tropospheric ozone? It has a huge impact on human health, with over 500,000 premature deaths attributed to exposure to ozone. It has huge impact on crop loss and productivity loss. And it's also a greenhouse gas that has contributed to global warming. So, of course, we all know in this panel, we know how important ozone is, but we now have to focus on these actionable things that we can implement in this short period of time. So with that, please, can you scan this code and so it will take you to the mentimeter.com. Once you're there, you can write down this code and we get started with this icebreaker activity. So please go ahead and do that. Was everybody able to join the Mentimeter activity so far?
Yes.
Okay, perfect.
Yes.
Let me coordinate with Monica because I think she's supposed to show us the results. So give me a second, please. Sorry, so it seems there is some conflict with the permits, so I'll have to stop the presentation for a little bit so Monica can present her.
Okay, can you hear me now?
Yes, go ahead, Monica.
Okay, then we have already the results from, I think that there's just one person participating, so the other ones are already, no, we have all the answers now. So we were asking about the level of effort needed to achieve these additional actions regarding ozone, but also asking you about how difficult is it going to be to implement additional actions in the following year. So it seems that we are all aligned. We all think that there are important impacts, and the level of effort going to needed to achieve this is also going to be high. So with this, I think that we can continue with the discussion, Ricardo. Thank you.
Perfect. So again, in this case, the task that we have at hand today is to the objectives for this scientific evidence for policymaking work stream, as we called it. We aim to address critical gaps in the scientific foundation, which are necessary for developing effective guidelines and policies to control tropospheric ozone and its precursors in various global contexts. There is also another aspect of this, which is able to define effective strategies to communicate the results and their implications to a diverse set of stakeholders, including non-scientific audiences. After a survey was conducted, we had over 60 participants taking part in this survey, and this is the preliminary list of actions that were considered as prioritized. As you can read them through, but basically we can see that the number one, the most voted one, was case studies to inform policy pathways that maximize combined climate and health benefits, expanded and sustained systematic observations, global chemistry climate modeling to inform the 7th IPCC assessment report, develop user-friendly, locally relevant policy tools, which include regime characterization and improved emission factors and estimates. Actually, I think 5 and 6 were equally voted, so we kept both of them. We were aiming to only keep 5 of those prioritized actions. The other ones are conduct regular updates of the tropospheric ozone assessment report, estimate the local and regional climate effects of historic changes in tropospheric ozone, conduct a crop and ecosystem assessment, and further building the health evidence base. So again, what we're going to do next is ask you do you think that there is an action that's missing from this list that you would like to see included, or otherwise, do you think that this is enough? So please go ahead again and scan the code, join the Mentimeter, and answer this question for us, please. I will stop sharing so Monica can show us the results of this activity.
Ricardo or Monica, would it be possible to put that list in the chat or something?
Yes, I'll go ahead and do that right now. Yeah, it's now on the chat. So the ones in bold are the ones that the six first positions in the list of prioritized actions. Okay, is that it? So far we, I guess, okay, yeah, we're getting more responses now. Monica, go ahead if you want.
The idea here is to decide if we want to add some other actions to the list that Ricardo has just shared. I think we can choose, in addition to the six that we already have, we can choose another 2 actions to that list. After this, we have to decide which are the most important to the experts that are joining us today, and then based on that, have a more deep discussion on how to achieve those actions. So I think that I'm gonna add this to the list.
Yeah, so as we see here, there is a proposal here to bump number 10 up in the list, which is like increasing the evidence for health effects regarding ozone exposure. There is one assessing the interaction between action on tropospheric ozone and air pollution and greenhouse gas mitigation, which I don't know, Monica or everybody here, we can maybe put like a star on that one in the sense that it might be somewhat included in the global model chemistry climate modeling. Somewhat, because that's perhaps how we assess that interaction between tropospheric ozone control and greenhouse gas mitigation, but that's just my assessment of that. And yeah, and the first one, I guess, is completely new. So go ahead, Monica.
Maybe I think that this is time to open the mic and hear to experts. What do you mean? If you can explain a little bit more these actions, and meanwhile, I'm going to add them to the other list. So thank you.
Would you like me to come in, Ricardo, and maybe?
Yeah. Just go ahead. We don't have to be super formal in this.
Okay.
Just like an open discussion. I guess the open discussion comes later, but let's get started with.
I enjoy a meeting that's flexible with the agenda, Ricardo. That's nice. So I propose the first 2, and I'm very nervous about an approach that tries to separate out action on individual pollutants for 2 reasons. One is that the impacts are the aggregate of all of the pollutants that we have in the atmosphere. And 2, it's very hard to selectively reduce particular pollutants from particular sectors, and almost impossible for ozone because you're trying to link it back to particular precursors. So that second suggestion about assessing the interactions between action on tropospheric ozone and on air pollution control, on particulate matter control, and on reducing greenhouse gases wasn't put forward from the point of view of the global chemistry climate modeling. I think it's more about the IPCC at the moment, their assessment is that if you reduce NOx emissions, the net effect of that is to warm the climate, right? So we might reduce ozone to some extent by reducing NOx, but because of cooling aerosols and all these other feedbacks, we're actually going to lead to a net warming. So there's a huge potential, if we just focus on tropospheric ozone, of having unintended consequences that we're not really thinking about. So that second one was about assessing. I think it links to one, so it maybe doesn't need to be its own action. I think it links to case studies that inform policy pathways that maximize combined climate and health benefits. I would just change one to say I don't think it should be case studies. I think it needs to be a global overview of those pathways, and they need to consider not just the impacts of ozone on climate and health, but the impacts of other greenhouse gases, of other short-lived climate pollutants, of other health-damaging pollutants. And then the other thing that I would add to one to make it really comprehensive is that the crop and vegetation impact should be included as well, because I know that's down at number 9 at the moment, but I think that's often the poor relation within ozone, is that we sort of forget about the impacts that it has on crops and just focus on health and climate. So I don't necessarily think that needs to be anything new. I think it sort of goes into one. And then the other one, which that you said was completely new, Ricardo, I think it's really important, if you want to grab the intention of people, of decision makers, to not suggest that they're having to burden themselves with a completely new pollutant that they've never heard of when they're already overwhelmed with work on trying to control greenhouse gases, trying to control air quality. I think you have a much stronger case if you're able to show that some of the actions they've already considered, that have been through their climate change planning process, that's been through their air quality management strategy, will actually achieve an additional benefit that they hadn't thought about. And so that first action is to try and review, for example, nationally determined contributions, where people are committing to renewable electricity production, people are committing to electric vehicles, people are committing to loads of different actions that will reduce NOx, that will reduce VOCs, that will reduce methane, that they prioritize based on their reduction in greenhouse gases or the reduction in particulate matter. And actually you can come in and say, you've got an additional benefit. You can contribute to avoiding 500,000 premature deaths every year. You can contribute to avoiding 0.23 degrees of temperature warming that you weren't even thinking about. The benefits of the actions you've already prioritized are bigger than you thought. And that's a really positive message to put forward to decision makers, rather than coming with an assessment saying you need to do this, this, and this now, rather than saying we've got additional reasons why you should implement what you've already committed to. So that was the basis behind that action.
Thanks, Chris. Someone else wants to defend their new propositions.
I can, if I may quickly pitch in. Hi, everyone. Roy from Clean Air Fund, Climate Science Advisor. I completely agree with Chris regarding two aspects. Like one on particularly, we should focus on multi-pollutant assessment rather than targeting a single pollutants. Also, although I do think in some cases, like just focusing on sensitivity experiments, like just 10 times increasing, and that sort of experiments really help to underpins like what's the exact role to some extent. But again, like completely agree that we need to find that in the last IPCC report, one of the major thing was
that is the already highly prioritized, but for having those case studies, still building evidence on health effects is extremely important, and funding has been lacking on that. So that just ties to the first point, I think. I also added something on information to the public and patients and so on. This is kind of in a general what we've been with overall advocacy on any air pollution and climate issues, that's where we're lacking in our effective communication to science to policy, that we have to also engage more public and patient and medical organizations. So that's something that I became quite passionate about, and it's a really powerful pathway to policy making. So I don't know if that should be added or not, if it's relevant for this exercise.
I think it's relevant because yeah, you're right. It goes in the same direction of what Chris was proposing here. Is what I understood, if I understood you correctly, Chris, is like really highlighting, using science to highlight the co-benefits of actions that are already being undertaken. So yeah, I guess these are not incompatible things here. So that's
we are converging.
Yeah. Dr. Lu, do you want to add something here?
Yes. So Ricardo, that I think you have already have a good starting point. So I have several comments. So first is the ozone issue discussed here, linked to what kind of spatial scales? Is it urban, regional, or hemispheric? Or you want to discuss all this kind of spatial scales? Point 2 is the difficult point of the current ozone pollution control in China, and also actually I recognized in many other places worldwide, is the control of its precursors. And the precursor control are often non-effective for the time period of maybe 1 decade or 2 decades. So if I observe the ozone pollution control in California that I observe between 1970 to 1990, 20 years, the ozone didn't change and even increased in between. And then start from 1990 to year 2000, then there is a fast decrease. And since the year 2000 up to now, it is almost then a slow decrease or almost constant. So similar phenomenon observed in Mexico City. So the point is, so since we want to inform the governors, so I think the situation we found here in China is, so the governors know that ozone is important, they want to control it, but then we always identify in urban area, it's generally VOC limited. But how to control VOCs? That is a technical issue which has to be solved, because the VOC emissions are often distributed. So you don't have a good method like the NOx emission control or SO2 emission control that you can have the point source and then you solve it with big machines. So it's similar for similar reasons in other places of the world. So the VOC control are quite difficult. That is one of the difficult tasks. So in the blueprint, I think that is a good concept. You have the blueprint, but how to implement it technically, that is very difficult. Which is also, we also look for solutions, actually. So some people said, okay, then maybe like what have been done in US, then we reduce NOx fastly. Then we should have maybe 1 or 2 decades of ozone increase, or maybe ozone keeping on high levels. But that is what has happened. So that is something to be discussed. Actually, we looking for wisdom worldwide how to solve it. And the third point is the health effect of ozone. I think is considered to be kind of minor when compared to PM 2.5. So people, I think there's some kind of consensus that the health effect of PM 2.5 is kind of one order of magnitude larger than ozone. So that's the reason that in China now some experts said, okay, let's forget about ozone. Maybe because we don't have the solutions, we solve PM 2.5 first, and then maybe at some point we have the technical solutions, then we control ozone. So it's like that. So we know it's like the health treatment. We know the problem, but now we don't have the medicine. So then maybe the decision is we wait for the medicine, and then so that's some comments. So basically, if we want to provide effective scientific evidence, that is what we have to consider. Okay, that's the comment for the moment.
Oh, thank you so much, Toru. I guess you just pointed out how difficult the next steps are gonna be, because we have to vote on how are we gonna prioritize these actions, and then we have to somehow provide even more detail on what steps should we follow through to implement those actions. So with that, I'll go ahead and try to get us started with the polling process.
Yeah.
Sorry, Monica, can you hear me? Do you think we should include I'm not sure how to proceed here. If we should, give me a second. I will.
You can go, Ricardo, to the next one.
Okay.
In that one, and then in that Mentimeter, you will find already the other actions that you suggested.
Okay,
What you
perfect.
will see there is the list of the previous actions, the new actions. And what we are going to ask you is please to rank those actions. You can just click and drop in the order that you think that those actions should be prioritized. Those are like the list of actions that all the experts have already recommended, but we need is to choose one or two to follow the discussion in this session. So
This part it's never easy, because we just saw like there are many different point of views. Sometimes the actions themselves can be somewhat overlapping, but yeah, let's try to do our best here to rank them.
So could you please confirm if you already can see the list of the actions?
Yes, I can see a list of the actions.
So
Thank you, Chris.
I'll go back to you, Monica. I'll stop sharing so you can access the page.
So we already have one person voting here, but the other ones can access the app and organize the ideas, please. There's still someone missing, but if you want to give your opinion, just open your mic and thank you. Now I see all the votes there.
Monica, so that's it. Is it done?
Yes. Now we have the voting, so we can continue with the discussion. Thank you.
So, okay, so it seems that design and implement holistic policies at national and subnational level. That's the one that got most votes. Assessment of O3 interactions with greenhouse gases and air pollution, and review the role of O3 in current policies, for example, in the nationally determined contributions. So I guess, let me see which ones are 4, 5, 6, 7, and 8. Okay, so Monica, from now on, we keep the first 3 and start discussing on those. Is that the main idea, I guess?
Yes, but this is just a tool. This is what the results are showing. But if you want to discuss a little bit more about the order and the ideas that are there, please go ahead. This is just to show you. This is an option to start the discussion, that going with 1 to the 3rd actions already prioritized.
So yeah, let's move to the next step, which is actually or is there any discussion here regarding should we bump up some of these actions to higher up, or because I think there are ways to what I like from the discussion we're having, Dr. Anderson pointed out that maybe there was something lacking regarding the stronger evidence for health impacts of ozone exposure. So maybe we could somehow consider that part of the case studies, but we could actually, I guess, make it more explicit. Maybe like a short list of mentioning that within the case studies, there should be case studies that are devoted to just strengthening the evidence between O3 exposure and health, for instance. But is there some level of agreement in the, let's say, the order of this pecking order of the mitigation actions? Just please feel free to comment.
Yeah, I'm happy with the order, Ricardo. I think it looks good.
Yeah, that's with that, I'll
Ricardo, you're muted.
yeah, I was just saying that we were going. Thank you so much. We were going to move on this discussion. So basically, our task now is just openly discuss about this and agree on the 3 actions that we consider are most priority, with the highest priority. And this, I guess, this is the next step, is the hardest part, is that how we make it implementable. How do we ensure that what steps should be ensured for those actions to be actually implemented and make a reality in the short time frame that we are discussing here. So we have to like properly define each one of these actions and came up with which are the barriers and so on, and the ranking of implementation. So I don't know, how do you think we should proceed? I would like to be able to actually have them up here, Monica.
Ricardo, the list is in the chat.
The list is in the chat. Okay, so
Yes, I put there the graph with the results.
okay, so perfect. Perfect. Thank you so much. So yeah, just go ahead. How do we proceed from here? The first one, I guess, is in a sense too generic, because for designing these holistic policies, there is still maybe we still have to understand the interactions. We still have to understand precursor specific impacts and so on. So just if you could just go ahead and elaborate a little bit more, it will be great.
Ricardo, maybe sharing the guiding questions can help in the discussion.
Okay, perfect.
Yes, we want to know which are the first steps. This is the group of research and science. So our question is, if those are the priorities, what can be done in terms of research? Are there already some research institutions working on that? What about the cost? Are there any finance mechanisms on place to work on these research gaps, for instance?
I'll try to put both things at the same time. So let me modify this a little bit.
Starting the discussion, are you happy for me to come in again, Ricardo?
Yes, it's perfect. I was just trying to organize here a little bit the display of the information. So
Yeah, it looks good.
yeah, go ahead.
I don't know that I can outline a sort of sequential set of steps to get to any of these, but maybe I'll just bring up a topic that I think is important and necessary but not sufficient, which is that of tools that allow different groups to be able to understand the implications of their policies and measures on ozone and its impacts on climate, on health, on vegetation. I think at the moment there is a lack of tools. There's been a lot of work done over the last 10 years to provide a set of tools that can rapidly assess the implications of different policies for climate and health and air pollution and health. At SEI, we have a tool called LEAP IBC, which is used by a lot of countries to do that assessment of impacts, but the health impacts are only focused on particulate matter and not on ozone. I think extending those tools that are used by decision makers to understand the impacts on ozone is a priority that could help to achieve can help in part to achieve number one. So I'm thinking, for example, about carbon markets, and there's a lot of work on carbon markets at the moment as Article 6 of the Paris Agreement gets implemented, around what are the actions that should be prioritized and what additional benefits a country gains by selling its carbon credits to a developed country in exchange for implementing something that will reduce carbon dioxide. And air pollution and health has been highlighted as one of those benefits, but I think only through the lens of reducing particulate matter. So, for example, there's a project in Thailand in which Bangkok is replacing its diesel buses with electric buses and selling the carbon savings to Switzerland against their carbon targets. And, the ethics of that aside, that intervention in Thailand can help to, improve ozone pollution. It can reduce NOx, it can reduce VOCs from those engines as well. But I don't think that's part of the consideration of those benefits. So I think, I think at the sort of international level, with that example for carbon markets, at the national level with environmental protection agencies or ministries of environment, and at the subnational level with cities, there's a need for the research community to develop tools that they can actually use to robustly evaluate the impacts that a measure might have on ozone and on health. At SEI, we've worked on this a lot, but we've found the approaches that are typically used to simplify atmospheric chemistry transport model results to allow you to assess impacts quickly don't hold up very well for ozone, because the assumptions that are made are generally linearizing nonlinear atmospheric chemistry. And some of that's okay for particulate matter, but for ozone, it falls apart. And so we found it very difficult to move away from saying you just have to run an atmospheric chemistry transport model to saying you can use a more simple approach to understand ozone impacts. But I think it should be possible, and a concerted effort to try and simplify the impact assessments for ozone impacts so they can be integrated into the existing mechanisms for evaluating policies and measures would be a really useful step forward that could potentially be used by a lot of decision makers, technical organizations that are already running climate and clean air policies and measures, but just haven't integrated ozone into it. So I think tool development is definitely should be part of this for the first priority, and possibly a couple of the others as well.
Yeah, thank you, Chris. I worry a little bit that how technically feasible that actually is. Like it's not easy. It's not even easy for PM. It's easier, but it's not easy, I would say. I guess your point goes a little bit in the direction of what Dr. Ke-Ding Lu was talking about earlier. I don't know if you want to comment on that, Dr. Lu, because yeah, that's the jam of ozone, is that it's not easy to actually quantify the local benefits from local actions, or the local benefits from global action either. So I don't know, just go ahead and comment on that if you would like to, Dr. Can you still hear us, Dr. Ke-Ding Lu?
Hello? So Ricardo, you are pointing out at me?
Yes, I was just wondering if you have something to add here in this part regarding what Chris just mentioned. He was talking about the importance of if you want to design and implement policies, then you have to develop tools that allows you to actually estimate health co-benefits or things like that from actions that are implemented locally in a city. But you, as you were pointing out, First, there is often a multi-decade delay between taking action and seeing the effects of ozone in a particular location, and probably local authorities in many places around the world do lack the tools to actually quantify those effects. So I don't know if you want to add something on that side of the, maybe that point us out to like specific research needs and who should develop these kind of tools and so on. Yeah, go ahead.
Yeah. So I have some thinking on this. So the point is, you have to have the quantified tools to attribute the responsibility. For example, that maybe not maybe. So for example, you reduce some VOCs and some NOx. Actually, the photochemical production of ozone in your city is actually reduced. But somehow, the ozone production surrounding your cities increased. And then the total ozone in your cities has no change. Or in worst case, it's increased. So you don't know whether you should do that. And more important, so in other cases, so the global warming, that now we fear that we have more and more heat waves, and also the biomass burning or fires. And then it also generates more and more ozone. So we have actions, and then we have counteractions also from the nature. So it emits more biogenic VOCs. It emits more biogenic NOx, and also methane. So it generates more ozone. So we sometimes have the argument that to the governors, so if we don't take actions, the ozone actually goes worse, much worse. But because we have the actions, so the ozone concentrations kept flat. So that is already achievement. But without scientific tools to quantify that, both modeling and also measurement tools, people cannot be convinced. So they only observe the result. You have a large amount of investment, a lot of actions, and then the ozone didn't change, or it goes worse. So that is not convincing. So only if we provide enough argument, scientific evidence, so then this decision to continue work on it can be supported. So that is, I think, one of the priority scientific areas has to be worked on. I think that's worldwide. So if you take actions and you don't have observations on ozone reduction, then you lose your support by the society immediately. So you have to convince that. And that is again like the treatment. So if you have treatment and you don't become better, and then most of the time you don't want that treatment. But then you have to have the actually the copy of yourself that without the treatment you become much worse. So that is something you have to convince. But often you miss that reference. So you don't have this reference. But now maybe with, for example, the digitized person, so the doctor can show you without the treatment, your healthcare situation maybe becomes much worse. So those tools. But overall, I think we still have to achieve a good result so we can finally get convinced the support of the people. And that, I think, my current understanding is we need actually to take actions at the national level. The nation means the big countries like China and US or the whole Europe. So on the scale of millions of square kilometers, in that scales, you take actions, and then for sure, I think you will observe achievement within 1 or 2 years. That should be convinced or confirmed. So actually, that is priority 1, I think, the first, which everybody selected. We should have to design and implement holistic policies at the national level. So actually, it's a big national level. The PM2.5 you can do on city levels. The ozone we do on big nation levels, or even on hemispheric levels. So that is also related to one of the point followers, that maybe will lead to be an international effort, that everybody contribute and everybody gain. But that again requires scientific assessment to convince the people that if we do together, we gain together. But that is also again the attribute of responsibilities. So who should pay? And now, like the President Trump in US, so if everybody put their country for the first, then the negotiation could be difficult. So that is a difficult negotiation, but people has to start. Okay, that some comments at the moment.
Thank you, Dr. Liu. Yeah, I guess that's what we are up against. How challenging it's to deal with global problems, whose time scale it's sometimes surpasses even the human lifespan, you know. So it brings me back to the point of co-benefits and health co-benefits. I don't know, Dr. Anderson, what do you think that there should be more efforts to create these tools that Chris was talking about, these tools to inform holistic policies, but which are strong on the health component? Just go ahead and help us out with that a little.
Sure, thank you. I'm listening carefully. I mean, I agree with many points. So I think we all agree that, of course, holistic policies incorporating multi-pollutant approach and giving us maximum benefits for health and climate mitigation is something we all want and need, but we're still far away, I feel, in practice. For example, now in Europe, there's a big financing of the projects looking at city level. There's a big push for city level solutions, which I think it's promising way forward, and development of health impact assessment methods at city level to empower cities and mayors to update their climate change action policies, incorporate multiple approach, prioritize health, and so on. But what's happening on the ground, and I'm part of several of these projects, we're still at the best doing one pollutant health impact assessments, because that's still simplest and easiest to do. Maybe we combine PM2.5 and NO2. We have now some idea how to avoid double counting, but ozone is hardly incorporated in any of these, as I have seen. There's also complication with our understanding of health effects of ozone. We have some understanding from US studies, but European studies, some of the latest big health effects studies called the LABS and ESCAPE, I don't know how much you know about them, don't show much health effects of ozone, and we understand that this comes back to the modeling of ozone at much larger scale, and because we're not capturing those very fine resolution at a city and neighborhood levels as we are able to do better with PM and NO2. This is probably explaining why we are not able to capture health effects as well as water pollutants. So there I go back to agreeing with Dr. Liu. We understand that impacts of PM2.5 are so huge and unacceptable that, then why not just tackle what you can solve, what you know you have to solve, which is PM, if we really want to enhance health, or and leave ozone behind. But I didn't think we can avoid still the need for research and better both modeling of ozone for health studies and more health studies to understand exactly what are the health impacts, because we are lagging behind in those to be able to really truly implement them on the equal foot with PM2.5 NO2 and those things. Another thing that I liked and maybe wanted to push up is this sector by sector, because now in Europe, in this, a lot of these projects developing these tools for the cities, for mayors, for governments to really evaluate the policies, prioritize the policies that, they're focusing very much on the things that are already ongoing, on low emission zones in the cities, on the wood burning, coal burning bans and so on. So they're kind of taking very specific what can be done by feasibility and trying to evaluate holistically those policies. So I think that kind of sector by sector thing could also be very helpful to kind of rank this and better understanding where can you act and what are the different possibilities within the sectors. That's also how policies are going around the states, at least in EU. But again, they shouldn't be too Europe centric. I know I am probably in taking solutions in Europe at least. So those are some of my thoughts. So of course, I think we agree on number one, but it's not easily actionable. And I don't know if that should make us maybe push something else that's more feasible and actionable forward, but I'm not sure then what that should be. Hope
you have a
Right.
great point there. It's like, how do we do this step by step? How do we at least give a few bullet points on how these holistic policies could be actually achieved? So I have no clue on how to do that, but so that's why we have you guys here. So Chris, go ahead and enlighten us here.
I don't know if I could do that, but I could talk for a little bit longer. I was thinking about the designing the holistic policies, and I haven't seen this research. It might be out there somewhere, but I wondered whether, a starting point, you want this to be short term, you want a concrete set of steps, whether the first thing is to sort of summarize the principles of what policies would look like that are effective in dealing with ozone's impacts. And I could imagine the first step in doing that would be a report or a review or a paper which outlines the impacts that ozone has on climate, health, and vegetation. And the key message of that report would be the different implications or approaches you need to mitigating each of those individual ozone impacts. The impact of ozone on climate is based on the total amount of ozone that is in the troposphere at any one time. The impact on human health is spatially and temporally, varying across the year, across different places. The same with vegetation, where you've also got the interaction with the growing season of when you're growing your particular crops. And so does the strategies that you need to reduce the total amount of ozone in the troposphere impacting climate, are they the same as the strategies that you would need to take to reduce ozone in a particular location where people or crops are located? And what are the different considerations with that? What are the non-linearities that you need to consider? What's the importance of NOx titration for health and vegetation that maybe you don't need to think about as much for climate? So that first level of interrogating the impacts that ozone has, the characteristics of how those impacts occur, and what that means for the approaches that you can take to mitigating them, and how you might be able to maximize climate health and crop through those interventions. And then I could see a second report or a second chapter, second initiative that says, how do those ozone impacts then interact with different pollutants, greenhouse gases and air pollutants? So you're sort of expanding out the holistic nature of how you're trying to design the policies. And I could imagine that then goes in two different directions. One is, how do other greenhouse gases and air pollutants combine to amplify or to decrease the impact that ozone has on climate, health, and crops? So vegetation is also impacted by climate change. It's also impacted by particulate matter, impacting the amount and quality of light that can get to plants. NOx forms ozone and it forms particulate matter. So you've got these combined impacts, and then you've got the co-emitted sources where you can actually reduce multiple pollutants at once. So I could imagine that could be a set of steps that would not be prescriptive in saying these are the policies that you have to follow, but would be sort of outlining the principles of if you're going to take seriously trying to reduce ozone at the same time of other pollutants, these are the key things that you have to keep in mind as to the nature of the impacts that ozone has and how it interacts with other pollutants. I think that could be a useful first step as sort of what you need to be aware of when trying to integrate ozone into your, emission reduction strategies.
Yeah, thank you, Chris. I guess I have been thinking about what you've been saying. Depending on the audience, we're addressing this, like trying to pitch this issue. I was just thinking, for instance, these are recent ECA. I don't know if you're aware of the ECA regulation that forces ships to shift fuels when they're like near shore. So that just makes me think that of course, it has like a huge climate penalty associated with it. Like many people believe that might explain how hot the last couple of years have been, just because we were successful in controlling PM emissions. So we're decreasing the aerosol indirect effect and so on. So it seems to me that health actually is the driver for most of these mitigation actions, which as Dr. Liu and Chris and everybody in this panel has agreed, it's very difficult because the temporal scales and the spatial scales of the problem might actually be in some occasions contradicting, right? So, but yeah, just Arindam, do you go ahead and share your thoughts on this?
Yeah, very quickly. And I guess the main concern here is the scale of those reduced complexity models. So whether we are going to address more of a city level local ozone problem, or we are going to address more of a regional or national level problem. And I do think like for a particular reduced complexity model to perform both of them at the same time, it's truly difficult task. And again, like it's the I know there are some integrated like in either integrated assessment models and some reduced complexity model which has tried to replicate them, but again, like there is a certain risk associated with with oversimplifications of the ozone chemistry, particularly that's going to happen in the atmosphere. Whereas ozone, like the basic science of ozone has been evolved in 10 years remarkably, especially in now previously we know about like the NOx and the VOC limited ozone, and now there is this aerosol attenuated ozone. So now every day we are basically every year we are at least having a couple of papers saying, highlighting roles of new oxidation, new particles or new stuffs that actually control the ozone in the atmosphere. And for reduced complexity model, it would be difficult. But again, like I do think like to make it like more policy relevant, I guess, I mean, reduced complexity model is possibly one of the few things that might have very direct impact on national scale or city scales policy if communicated properly. But yeah, it's sort of a pros and cons of these two. But technically, whether it's a feasible or not, like just to get Arc system models data and transform into a reduced complexity models output, I do think for ozone it's a very, very challenging task for the group who wanted to do that.
That's a great point. Maybe there is the need, like when developing these tools, there has to be some the tools must be somehow like scale aware, right? Like it's probably not gonna be one tool, but maybe several interacting tools. That's the point. They still have to be developed. If they're to be like useful for a city, or useful for a country, or useful for the international community to use them. So that's a great point. Then of course there is the issue of who should pay for this? Who should finance these tools, and whose responsibility is likely to be of this kind of stuff? So it should be, as Chris said, like maybe environmental protection agencies, or is like more like national health institutes, or should it be like a combination of these groups? Or I don't know. What are your thoughts on the finances of this? Like who should let's say call on the scientific community to try to focus on developing these tools and helping out the design of policy? So just, I don't know, go ahead and give us your thoughts on this. Chris, could you help us out here, Chris?
Sure. Maybe I just make one point, because I was thinking about what you said, Ricardo, about the example of the shipping regulations, and I completely agree with you that ozone should be not put in that category where you're just trying to reduce it for one. Like you could have a policy where you're trying to only reduce NOx for ozone purposes, and actually you have a negative impact on climate when you think you're doing something good. So I agree with you, there is that risk. I think where I disagree, and I agree with you that for the shipping regulations, the driver of the desulfurization of fuels for shipping was health. But there are also examples of the opposite. For example, the incentivization of diesel in Europe in the 2000s, which encouraged European drivers to switch to diesel vehicles for climate reasons, and then had a huge impact on human health. So I think the message for ozone, by placing it into a context of looking at other pollutants that are co-emitted with it, is to say it's not just about health, it's not just about climate, it's designing the strategy that achieves benefits for both of those issues. And I think that we have a good understanding now of the specific actions that you can take by sector, and I think the sector by sector guides are really useful. We have a good understanding now of those actions that will simultaneously reduce greenhouse gases, ozone precursors, and other air pollutants. So I don't think it's sort of, I don't think we're dreaming in thinking that we have to choose between these two. I think we just have to be smart in selecting it. In terms of the funding of who should fund these things, I think the priorities that we're talking about here are that, like, the first step is the scientific community developing guidance, developing tools, developing the approaches to these things. And then the second step is then sort of their dissemination to people who might want to use them for decision making in specific contexts, for specific countries, for specific cities, subnational organizations, and things like that. I'm much more familiar with the second type of action than the fundamental sort of scientific research funding. The second type of action, there are lots of different organizations, but a lot of them are linked to overseas development aid budgets. And I think, in the work that we've been doing over the last 10 years, there's been a lot of funding either funneled through organizations like the Climate and Clean Air Coalition, where countries will use their overseas development aid budget, but put it through a UN organization or an organization like the CCAC. So I think UN agencies, CCAC and people like that, they've got a long track record of supporting this sort of holistic climate and air pollution thinking. But I think there's the opportunity, you know, I'm in the UK where we've just halved our aid budget. So maybe we're fighting against a, you know, maybe it's not that useful. But I think there's an argument to be made that the work that we're proposing here allows countries who are providing climate finance, who are providing action on air pollution, to achieve more with that money. So I think there's an argument here to say that if you're thinking about how to allocate your aid budget or your climate, you know, finance and things like that, you should think about funding some of these activities, because actually they can help you achieve multiple impacts that you might see as a priority with the same amount of funding, because it helps you to target that funding much more clearly to interventions that have these multiple benefits. And that's the only insight, I think, into the into potential funding of it.
Thank you, Chris. And I know that the funding situation is very different across the globe. Probably the way it works in China will be very different than the way it works in Europe or the UK or in Latin America, which or Africa, which we're a lot more dependent on actually like international funding to just develop research and things like that. I don't know, Dr. Anderson, do you have an idea on who should shoulder the burden of this of financing this type of research and development of these type of tools?
Oh, $1 million question.
Probably multi-million-dollar.
Yeah. Well, of course, we hope all national governments put in more efforts in these. These are really existential problems, but unfortunately, we're seeing less and less funding, both in environment, climate, and general disease prevention. So there could be a really good shout out of this effort to point out that, you know, the gains, just if you, I mean, we're in different efforts trying to raise this point with all different agendas, from prevention of non-communicable diseases, for infectious diseases, but I think it's unfortunate things are going in a wrong direction with financing. So we're hoping more of these private foundations will step in, and we're seeing some effort for Wellcome Trust. Even in Denmark, we have Novo Nordisk Foundation, which is now globally second one, which is kind of trying to get out there and fund more of these things, but we haven't seen anything really specific on exactly these issues. So I don't have a good answer, but I think, yeah, so shout out for need for funding and commitment also from national governments and for us in EU, because they're really, they're for sure solutions that would pay off in the long run. And I mean, a lot of the cost benefit analysis in EU for reduction of main pollutants and show that we use them for political arguments to implement stricter policies, but they could be used as arguments to increase funding for speeding up solutions. So I don't know if that's appropriate to put in one of points in the this report. So we need funding for whoever can provide it, both national and private foundations. And
there is the other issue that sometimes I see here is like, of course, probably in terms of research and fundamental understanding, the global north, it's likely to be way ahead of what's going on in the rest of the world. But sometimes the let's say the specifics of the cases that work for the global north might not be the things that work in the global south or globally, let's say. So I'm just thinking here, maybe forest fires or wildfires is probably not a big issue in Europe or even in the US, even though like now it kind of is, but it's like huge, like all across the equatorial globe, you know, and it probably has a huge impact on the global budget of, you know, precursors of ozone and NOx emissions and so on. So yeah, maybe tailoring the effort for specific regions could be a good point. So maybe focusing those efforts that will have like local air quality benefits, but at the same time, global, I'm gonna switch the co-benefit thing here, like local benefits for people, and then global co-benefits in climate and atmospheric chemistry. That could
Well,
be
that's a very good point. I think we were at COP28 2 years in Dubai. I think Wellcome Trust committed a lot of funding, but then it goes quickly just to adaptation measures. And, I think we still miss that first chain of just, well, what are the health effects? Let's map that. And what are the, the initial mitigation, or just understand still that initial step of mapping getting the right relative risks of association of each of the pollutant and their mixes on health, which we need for good health impact assessment and policy design. So still that part is still kind of gets missed out. Now we're all committed to adaptation. How do we solve this? Like evil is so. But Global South, Global North is a very good point. I think Wellcome Trust actually developed a lot of good kind of global calls, wanting to have some partners from countries both from north and south. So that's a very good initiative to include partners from globally. But generally, we just lack one. Even in Denmark, where I am, which is one of the richest countries and has achieved significant improvements both in city planning and the national, we're struggling more and more for money. There's less money in environment, so it's really hard to understand where we should be leading in this. And I'm sure there would be societal economic benefits. Sweden also, I just heard they close money to some of the NGOs working in environment. So things are going in wrong direction, kind of in line with political agendas against discredit in science and so on. So we see that really even in very global north, the rich north where I am, that funding is just diminishing rather than increasing in this area. So I don't have a answer to your question, but I guess a need for funding is definitely a problem here.
Yeah, maybe it's not relevant for this focus group, but do you think that's happening in part because of the success in improving environmental conditions? So maybe it's like people kind of forgets about how they got there. I don't know, like sometimes I struggle to understand it.
Point. I don't think, I think we're going more into this populist politics are more about now, when the war and hysteria about other issues take over, the environment gets pushed back, despite the common sense that we also have to solve these crises. That's my feeling in the north. But also there has been misunderstanding because we achieved some improvements in health effects of air pollution, that understanding that we still have so many people actually dying more of air pollution, with new understanding that how big impacts of air pollution are, with new studies showing highest impacts. So we see now in Denmark that more people die from air pollution now than 10 years ago. All the air pollution levels are lower because we have better understanding of impacts that more and more people die of. The associations are stronger with newest meta-analysis. We have now dementia, we have new diseases linked to air pollution. That has been difficult to communicate. I think it stops there. If air pollution successes has been achieved, kind of we're done without realizing the need. We still need to evaluate it. Have we regulated the right toxic element? Are health effects going down? And what that gets left out for sure. But I see that in other areas of general prevention, also with smoking, with alcohol, there's just very little ambition in general prevention across funding. So yeah, that's my take on it. So I hope we can raise more awareness and get more funding, but it's unfortunately in Denmark, it's going in the wrong direction. In Sweden, we're a little bit pessimistic right now. So we're hoping for EU funding is still very important source for us, but there's higher competition, even from US, because US funding is closing. So things are quite tough in the field to get money for these priorities.
Okay, yeah. It's not easy at the moment. But I'm optimistic that things will change, I guess.
We have to be. There's a lot of good work done out there. And again, as we talk to policymakers, we have more than enough evidence. I mean, what's going on now in EU, there's a number of policies revised as part of the Green Deal, and we just passed the new air pollution law. The evidence is huge already to act. That's one message. And then we need to address the gaps and so on. But those two things shouldn't be mixed up. There's more than enough evidence for policies to be implemented. But I have to go literally in 2 minutes because I
Yeah.
have the workshop.
No, we will close this
But we are
like
wrapping
right
up.
now. I actually wanted to thank Dr. Mali, Dr. Anderson, and Dr. Lufor for your invaluable insights here. It's, really thanks. We are thankful for your time. There is one last question. It's like a 30-second question. Do you agree to have your name included as a contributing actor in this activity? So yeah, thank you so much. I guess
Thank you for organizing.
Monica and the Clean Air Institute people's gonna send you the results of this. Like so yeah, thank you so much for your time and your effort.
Thank you.
Okay, bye-bye.
Thanks, Ricardo.
Thank you. Bye.
Thank you for your time.
Okay, Monica, I guess that's